host. Always excited to be here. And today I'm going to be sharing some tips for new grads. However, if you have not graduated yet, or if you have not even gotten into dental hygiene school yet, I want you to know you can still enjoy this episode because there's a lot that we can take away from what I'm going to discuss today. I have so many tips for people who are graduating soon. Honestly, it's hard to even know where to begin. So let's just dive in and see what comes out of today's episode. I'm going to go a little bit off the cuff. One thing that I wish I had done when I graduated was to have a daily reflection or check in on how I perceived my day. And I would have checked in with a couple of different things. The first would have been, timing. How was I on timing today? Maybe what went right, what went wrong? What do I need to adjust? I say that because as new dental hygienists, we're just fighting to survive, right? You're just like, and the same is true in dental hygiene school and clinic. But what I'm going to really encourage you to do is start to realize where your hangups are. These little hangups are known as friction points, and we all have friction points throughout our day. And I think we forget sometimes that we have the ability and the opportunity to make our lives better every single day in even very small ways that you may not even think are worth anything, right? Something that I've been really doing lately is trying to work on reducing friction points in my life. How do I make my life as easy and seamless as possible? And I know that may sound kind of crazy, but when you're working in the confines of dental hygiene, if you're working in a clinical job or any job, I mean, even in education, I'm in entrepreneurship, life is hard. The things that we have to do every single day are not easy. Why are we not, having opportunities to make our lives a little bit easier? Examples of this could be if your keyboard is too far away, get a wireless keyboard, right? So if you have a wired keyboard and it's too far away and you have to roll back and forth while you do your pericharting, get a wireless keyboard. It's such a simple change, maybe cost 20, 30 bucks, but think about what it saves you in your day-to-day life. I think sometimes we get in the mindset that the doctor, if we're working in a private practice and we're working under a doctor, that the doctor should buy us everything. The doctor should buy us a saddle stool. The doctor should buy us a wireless keyboard, all this. Maybe you have a great doctor and they will buy it for you. But if you ask and they say no, just tell them, okay, then I'd like to buy it on my own, and start saving up money and buy it on your own, because this is your life. This is your career. You want to make sure that you have the tools, the support, everything that you need to do your job well. If you like your office, but they can't afford to buy you instruments, gosh, I know a lot of people are going to disagree with me. I would buy my own instruments. I would buy all my own stuff, and then I'll take it with me if I need to go, right? Or if I want to go anywhere else. I say that because we cannot work with equipment that does not work with us. And we have to be able to eliminate those friction points, make your job as easy on you as possible. Okay. The other thing that I think is kind of interesting, and this is more of a reflection, when I was seeing one of my previous hygienists, I would go in and she would hand scale everything and then Cavitron at the end. And I always thought that that was kind of backwards. Actually, she's a piezo, but I always thought that was kind of backwards, because what is the purpose of powered instrumentation? One, you use it on the appropriate level for whatever's there, right? And you use the appropriate tip for whatever is there. Meaning, if there is not significant calculus, if you're just lightly deplaquing, light calculus, things like that, okay, you can use a certain size tip for that on a lower power setting. But the benefit of it is you are debriding every surface. You're also killing bacteria on contact, right? That's less viable bacteria that gets in the patient's bloodstream and travels to the rest of their body. So if we're basically killing bacteria as we're removing it, and we're also suctioning at the same time, right? So we're getting all that stuff sucked out. That's less kind of bacteria that's just free floating around in the pocket that could get swallowed, that could get aspirated into the lungs. So I personally like to start with powered biofilm removal before I pick up my hand instruments at all. I do that for the patient's benefit. I also do that for my own benefit, because if I can go in there and remove the bulk of the stuff with the powered instrument, which it saves your hands and your back and your neck and all of that a lot of energy, right? It's going to be good for you and the patient. All right. So can you always do that? No, right? Patient by patient basis. life, equipment, whatever, things come up. But it's just something I want you to think about, right? The powered instruments, they are designed to make your life easier, but they're also designed to help your patients and help them get more healthier as well. And to protect them, there's just so many reasons why I recommend doing that first. But again, it's all going to come down to what you're comfortable with, what works for you, but that's just the way that I do it. The other thing that I would reflect on at the end of my day, we talked about removing friction points. What is making your life harder in the op? Let's smooth it up, make it easier. Maybe we need to buy some things. Maybe we need to save up some money so that your day-to-day life looks good. You're comfortable. If you buy a pair of scrubs and they're too restrictive, or they're making you sweat too much, it's like, okay, maybe there's some trial and error. We're going to have to try a few new things, right? So sometimes we'll buy all new like scrubs in one set, like one brand, and then you're like, oh dang, I don't really like these. It's okay to try things out. That's the beauty of being a new grad. You're like, I'm going to try this today, and I'm going to see how it goes, and then just reflect at the end of the day and see if it made your life better, worse, or didn't make a change. Okay. When you're reflecting at the end of the day, I would reflect on a couple of things, and you could just do a simple, on a scale of 1 to 10, how much pain was I in today? I think it's very important to start tracking your pain sooner rather than later. This is something that I did not learn until recently. Okay, for a long time that prevention, right, is the key. That's what we do as dental hygienists. Like, our goal is to prevent disease, right? We are horrible at preventing disease in ourselves, and we are horrible at just working through the pain. I'm speaking from experience. Okay. I started having pain in dental hygiene school. There were things I should have been doing proactively then. Okay. And sometimes it's hard because you're looking at money, you're looking at time, you're looking at resources. I'm going to just say that if I had consistently been working out, and I wish I would have gotten a trainer or somebody who could help guide me, because the money you put into an investment in people who are skilled at their craft. So for an example, a personal trainer, especially if they know dental hygiene and how to work with those unique situations, they can help you build the muscles and give you what you need to where eventually you probably won't need a personal trainer anymore, right? So you put that money in up front so that you can get the pattern, the habit, the assistance going, you learn the skills correctly, and then eventually it's a part of your regular routine to exercise, right? But you have all of the knowledge that person gave you. So lately I've been, I've been on this whole health journey. Many of you know I have endometriosis. I had surgery. It's been a whole thing, but I am seeing how, I tried to take care of myself before. I really had to go through the surgery to even be at a point where I could like really take care of myself to the level I am now. The amount of time and effort and money I'm putting into getting to a point of stabilized maintenance is insane. Whereas if I had started some of these things years ago, I probably would be at a maintenance pattern where maybe I do only need massage once a quarter instead of needing work done on my muscles once a week because I have 11 years of damage that I did not tend to. Okay. So I want you to start thinking about that. What can you do on a regular basis to get your body prepared for this career and to maintain it long term? So, what that might look like, I think there's multiple things. Okay. One is some type of exercise. I think we need targeted training, and you want to, again, be making sure that you're taking care of your body and you're not going to injure yourself doing something crazy, but we want to really target muscles that are really going to help us. You want full body health. That's what I think of. And if all of your muscles are working well and they're working functionally together, then you're going to be better at your job and you're going to have less pain. The other thing is that preventive maintenance. So, foam rolling, heat, ice, whatever that may be, to keep things comfortable, physical therapy should you need it. And then also, did I say massages already? Chiropractor, if you're into that sort of thing. For me, a daily routine, I pretty much foam roll, stretch every single day. Okay. I have so much like built up, like, I don't know if you would call it scar tissue, like fascial tightness, that I'm getting like manual massage with like metal instruments to break up all that stuff. And it's taking a lot of time. But once you do the release and you get the muscles relaxed, you have to make sure that they're strong enough to support you. Otherwise, the pain cycle just continues, right? If you just get the massages over and over, but you don't strengthen the muscles, then you're going to just be in a constant cycle of pain. Like the massages will help for a day and it won't get better. This is something that I just let go downhill for years and years and years. It got to where when I was practicing clinically, I could work, let's say when I first started, right, 4 to 5 days a week. I would have 2 to 3 days off, and I would recover. I'd go back. I'd be good Monday, Tuesday, Wednesday, and then about Thursday, my back would start bothering me, my shoulder, things like that. It got to where about 5 years in, I would go into work on Monday and my back was already hurting. It wasn't even like a slow build up. I was just in pain all the time. Okay. I should have done things differently. So I'm going to encourage you. If you can get into that preventive mindset, right? Really start foam rolling, start stretching, getting regular massages. And if you are routinely ranking pain on a day to day basis, you have to look at what's causing the pain and you have to actively change it. So if you can reflect at the end of every day, just say on a scale of 1 to 10, how much pain did I have? Where was the pain? Okay. Because if it's like, oh, it's my shoulder. Okay. Are you flaring your shoulder? Can we make adjustments? Do we need to do some exercises to help with that? Some stretches. You can tailor it before it becomes a big problem and becomes chronic, widespread pain. The other thing I want you to think about, reflecting on your stress levels for the day. On a scale of 1 to 10, how stressed was I today? If you are constantly ranking high stress, you need to start thinking, what was my highest stress? Okay. Is it the schedule? It's too fast paced. I'm struggling. Okay. Is that getting better with time? Is it the doctor? The doctor is mean to me, or the assistants, the workplace, the culture, something like that. If that's the problem, okay, how are we going to fix that? The thing is, if you don't check in with yourself regularly, you will keep going until you end up like me, where your nervous system is overworked. Okay. So years and years of what I put my body through, not only the pain, also my chronic illness, which I can't blame myself for that, but it was a rough go. Pain, anxiety, my nervous system, it is shot, honestly, right now. And I'm really working on it to get to a point where I just can relax my body. Like my muscles are chronically tensed up, right? And little things trigger that kind of anxious, like stressed out feeling that shouldn't be, right? And it's because of years of this pattern that I allowed to go on unchecked for a really long time. And I also allowed myself to stay in situations that weren't good for me mentally or physically for far too long. Now, one thing I'm going to say is when we make a choice like that, let's say for me personally, what it was, my goal was my husband and I wanted to pay off all student loan debt as quickly as possible. So I worked in some offices longer than I wanted to because that was our goal. My goal was I can leave here, I can move on, I can move towards my dream career of teaching once we pay off the debt. I made a choice, but I did not accept the consequences, meaning I was miserable every day. I was upset, but I could have made the choice to leave, but I didn't. So what I should have done was accept the consequences, right? Instead of just continue to suffer every day, I should have just said, this was your choice. You decided it. And so that's what you have to be okay with the consequences, right? If you make that choice and you're not okay with the consequences, you're only hurting yourself. You're not gonna, you're not taking care of yourself. So either you change the situation, right? Different consequences, or you stay in there in that same situation of negativity, pain, whatever it is, and accept the consequences. That's your choice. But whatever choice you make, you're making the choice, right? So I want you to really reflect on your day in, day out, and just think, what are the choices I'm making that's helping make my life better? And what are the choices I'm making that's making my life not better? Okay. Because I really think that to achieve the life you want to live as a dental hygienist and whatever else you decide to become in the future is to reflect on your life every single day and really think through, like, am I moving in a direction where I'm getting to a point where life is overall good for me, free of pain, you've got what you need. Yes, it would be nice to like live on an island somewhere and never have to work again, but is that the reality? No. So how do we live our best lives day in and day out? And there's many factors that go into living your best life. Work is one piece of the puzzle. There are some people who literally just work to live. They're like, I go into work, I do my job, I do a fine job. Like I do what's right. I do what I'm supposed to, but it is just work to me. There are other people like me that work is my life. I love what I do so much that it's a passion of mine. So, um, either way, wherever you're at, it's totally fine to be any of those things as long as you're okay with that, right? And you're not letting one dictate other areas of your life. What are other areas of your life? Your personal life, your relationships, spirituality, if that's important to you, physical health, mental health, financial health, right? There's so many things that go into an overall life and what life looks like on a day-to-day basis. If you're coming home from work every day and all you can do is talk about how you hate your job, you're miserable, all these things, you're not living your best life, right? But if we do a little bit of reflection every day and we start figuring out the things that are making life more difficult, we really like put that into a lens and just ask yourself, what's one thing I can make better for myself today? Just one thing. Do it, right? If it's like I'm struggling to eat healthy meals every day. Okay, well, what's one thing that you can do to eat healthier meals? Maybe I need to do a meal service because I don't know how to cook, or I don't have enough time to cook because I'm a mother and I have children and I have duties and things like that. So maybe I need to do some type of meal delivery service for now in this phase of my life. Make the choice, right? We have so many things available at our disposal to make our lives easier these days. It's okay to make your life easier. All right. I want you to remember that. The last thing I want to mention, think about where you are now and think about where you want to be in the future. Right now, you may only have the vision of, okay, I'm going to graduate, I'm going to get a job in private practice, and that's where I'm going to be. And that is great. But I want you to think about, how can I expand on that? How can I keep expanding my skills? What do I see long term? I really think that there's two methods of thinking that I see a lot, on social media and out and about in the dental hygiene space. I see a lot of people saying, don't become a dental hygienist. You're going to hate it. It's terrible for your body. It's a 10-year career, all of that. I think that's true if that's what you want to be true, right? For me, I've had chronic pain since the get go. Unfortunately, it became very apparent to me that practicing clinically for a long time was going to be a struggle. It didn't matter because I already found that passion, knew what I was interested in, which was education. So, what did I start doing? I started making the steps to become an educator, right? I got my master's. I started working part time at a dental hygiene school. Then I moved to full time, right? Did that for a while until eventually I opened my own education business. So, think about the steps to get where you want to be. So I see these people online that are saying, do you want to get out of the op? And I see some students, they're already saying, I already know I can't do this for the rest of my life, or this is not what I thought it was going to be. That's okay to have those feelings. I think you should give it a try and see how it goes. But if that's how you're feeling now, then start networking, start reaching out, start finding other opportunities, try a bunch of different things. It's okay for your career to evolve and expand. And often, if you allow that, you leave space for opportunity to try new things. You never know what's going to come out. I am so excited. I'm going to have some really amazing guests on I always have amazing guests on the podcast that are doing really incredible things, but really looking forward to some guests that I'm going to have upcoming. My friend Melanie, who owns her own dental endoscope business. She travels around. She's working clinically in the op, but she owns her own business. It's just incredible. I think about people like her and what is possible for you in your career. You may get really into guided biofilm therapy in the op. You may get really into tobacco cessation, and then next thing you know, you're leading talks on tobacco cessation for your colleagues and peers. Whatever it is that is piquing your interest, I really want you to go for it. That includes in your professional and your personal life. Okay. I want you to think about that a little bit differently from the get go. You always have opportunity. You have the capability to make choices. Whatever choice you make, we have to be okay. There's always a consequence, good, bad, ugly, whatever. It's okay to make choices to make your life better. And that is what I would leave my new grads with, at least this year. I always think when I do these new grad episodes, sometimes they go in the direction of what I'm thinking about at the time. And I'm definitely thinking at this time, how do you live your best life? That's a question that I want you to go into this new season of graduation and starting your new career. I want you to ask yourself, how do you live your best life? Dental hygiene school has been a tough slog. It's been rough, right? It's behind you now or will be soon. And what comes next? That's the exciting part. So I'm going to wish you all best of luck on your journey. Registered dental hygienist, you're going to crush it. Have an amazing day. If you have any questions or you just want to share what you're up to, what your plans are after graduation, I would love to hear from you. You can reach out to us on socials at Dental Hygiene Basics. And then, of course, we have our newsletter. So if you are still in school, you're looking for tips and tricks, head down to the show notes, click on the dental hygiene hurdle, and you can get signed up for our newsletter. Thanks, everybody. Have a great day.